president of the Children's Bureau in 2016, a few months after my first son was born, and learned a lot about it through and followed under the wing of Paul Fairborn here in the back. So thank you, Paul. The agency does incredible work, necessary work, that uplifts the lives of children. So cheers to a lovely evening together full of friendship, fellowship, and connection to an organization with a hopeful mission and vision. And with that, I would like to introduce you to Ron Brown, President and CEO of Children's Bureau.
So why Hope Talks? What's the point of this? We're grateful that you committed to being a partner in Hope and by just being here and are interested in learning how this important partnership to protect vulnerable children and families can exist and what we can do. And we've created these to provide an intimate kind of space, a casual space, if you will, for our most valued supporters to learn more about what we do and why we do it. And to provide an opportunity for those who'd like to learn more, how they can help connect with our mission, with our vision, and others that would support the same kind of outcomes for the community that we all share, by the way. And with that, I want to welcome you officially to our panel discussion, Understanding the Foster Care and Adoptions Landscape. Thank you all for being here, and thank you all.
How do we follow up with that? Ron, Dr. Brown, is fantastic. Okay. Cindy. We hear so many negative stories in the media about how the system fails children. Can you please describe the type of situation in which a social worker would deem it necessary to find a new home for a child?
There's an overarching series of events that often result in children needing to be separated from their families and join families in the foster care system. And that includes homelessness, mental health issues, substance abuse, domestic violence. And there are other reasons, but underneath those overarching reasons, there is what ends up resulting: physical abuse, sexual abuse, neglect, and babies born with prenatal drug exposure, or parents using drugs while they're trying to care for their children, which ends up in children being neglected. The majority of our families, our children who come into care, come from family circumstances such as those. The majority of our children are also children of color. There's a disproportionality of children that come into care. And interestingly, many of those children are siblings. A small sibling group would be considered 2 children. A large sibling group is anything larger than 2 children. And historically, we have successfully joined sibling sets up to 6 children with our families.
So Dr. Hill, in your work at Cerritos College, you interact with former foster youth who are trying to achieve higher education through the LINK program. Can you share some of the demographics of the student population and some of the challenges former foster youth face?
Cerritos College has, enrollment is down across the state because of the pandemic, but our college enrollment for foster youth or former foster youth has remained somewhere in the neighborhood to 400 to 500 students per year that we serve. So they come to campus. Some want and know to look for services, others do not. So we are a well-kept secret. So in our counseling office, we run programs related to foster youth. We have a program for Latinos looking to reconnect with their communities program. So those 3 programs will have, undoubtedly, students who have, the term used to be aged out of foster services. And they're just there with us and they're like, how do I do life? That part is the hard part. Because think about this, when you registered for classes in college that first semester, it was a little different. but you could go home and talk about it, you could share. You had a sibling who had been through it before and said, no, it's okay. They don't have that. They don't have that. And so we provide services, we help us.
So let's turn our conversation to how social workers and clinicians can help birth parents, foster parents, and adoptive parents create permanency for children, because we're about the solutions, right? And we're going to start with Eileen. From an administrator's standpoint, some of the best practices in the field of foster care and adoption.
Why is it that we are not able to have children have continuity and commitment of care and a legal and social status that comes from having a safe and nurturing lifetime relationship? Why can't we do that? Yes? So it's because we don't have, in most places, what we call a model of practice. It means that everyone is committed to the same mission. So everybody knows what PTA is here within your context. You have to have a vision and you have to have a mission. And everybody has to work to their competency and as a role reciprocal with everybody else. So, okay. But sometimes we have agencies where the foster parents are working toward one goal, the workers are working toward another goal, the birth parent has another goal, and grandma shows up and she wants to do something else.
This is, again, very, very hot topic. We're in the middle of it, and we're looking at shifting the concept of mandated reporting to community supporting. So how do we build community supports for those families instead of having a mandated report for those children that are not in physical risk?
You know, I saw a sign on the cash register at a convenience store that said, it's tough out there, be nice to the people who show up. And yeah, it's true, so you showed up. And that's a big deal. So that gives us hope. So thank you for showing up.